Good afternoon, good morning, wherever you're viewing from. Thank you so much for joining us today and for kicking off National Dental Hygiene Month, taking time out of your day to join us. Today, our session is Stopping Progressive Disease in Its Tracks. I'm Sandra Lambert. I am part of the clinical education team here at Candid Pro, and we are so happy that you have joined us for today's session. So just a few housekeeping items before we get started, just to let you know that this session is being recorded and a recording will be sent to you in an email following the presentation. Also, there'll be a Q&A that can be answered at the end of this session. So if you have any questions that you would like to ask at the end, please feel free to put that in the Q&A portion on your Zoom screen. And lastly, for this presentation today, you will earn 1 continuing education credit. There will be a QR code presented to you at the very end with 5 questions to answer, and then you will receive your continuing education certificate, your continuing education notification in your email as well. So without further ado, let's take it away. Thank you again for joining us. So our agenda today, we will cover the importance of healthy occlusion, who would benefit from treatment, and getting started, and covering patient conversations. So a great opportunity that presents to us in our dental practices is a statistic that was shared with us by the American Association of Orthodontists. So according to the statistic, 75% of the US population presents with some form of malocclusion, so some form of their teeth not being in a healthy protected bite, which really equates to 75% of the patients in your practice could benefit from clear aligner therapy. Still, we find an overwhelming number of providers that are not actually addressing this in their dental practices. So I will say thank you for joining today. You are clearly one of the practices that are offering clear aligners, and thank you for being on this path and journey with us. So let's talk a little bit about the importance of healthy occlusion. So clinical philosophy in the GP dental setting, really, it becomes part of weaving clear aligners into the treatment planning process and the treatment planning protocol, bringing full comprehensive dentistry to your practice. We focus very much traditionally on the periodontal foundation. We're looking at the hard tissue, the soft tissue. We're looking at bone level. We're looking at gingival health. And we're very much focused on the restorative work that may be there or restorative work that may be needed, that our patients may need. So there's that middle world, and it's that position that our teeth are in. And that position that our teeth are in actually directly relates to periodontal conditions and restorative longevity. So weaving the ortho, which actually means straight. So we're looking at our teeth being vertically inclined, straight up and down, right? As part of the treatment planning process. So if we're looking to improve periodontal health, if we're looking to provide restorative work or keep the restorative work that's there, we also need to include the fact and do an exam, an occlusal exam, to make sure that the teeth are in the right position to support the restorative work and the periodontal foundation. And of course, we're in relationship-based dentistry. So this absolutely builds on the relationship and the rapport that we have with our patients when we include and weave this all in together and share with them any concerns that we might have, and then moving forward with the necessary dental work. But also then it builds credibility in offering clear aligner therapy as part of the treatment planning process. So some common types of malocclusion that we see in our practices, that we see every day. And I'll just see if everyone here is on their toes. So of these common types of occlusions that are here, malocclusions, there's one that is not malocclusion. Can you all guess which one that is? Taking a look. Yes, you're right. Healthy is not a common type of malocclusion. But these are malocclusion. And what we know is that malocclusion is a disease. And this is a disease state that we can actually discuss with our patients. When we're educating our patients on the importance of a protected, healthy bite, when we're educating our patients on the importance of putting their teeth into proper alignment, we actually have the backing here that states that this is a disease. This is occlusal disease. If I go to any medical profession and they tell me I have any kind of disease, it is a call to action for me, right? So when we talk to our patients about malocclusion being a disease, it actually will become an attention grabber, and your patients will have attention to this matter. So some of the effects of malocclusion. It's important that we know what the effects are, and having this visual here helps me very, very much. This visual is provided to us by BiteFX, and it is a profound treatment planning visual tool for our patients so that they can see the effects of the breakdown that's happening in their mouths as a result of their teeth not being in a healthy protected bite, right? When we look at this diagram over here, we see that the teeth are coming in at an angle, right? And they're actually right here hitting on that buccal cusp. And that's not how our teeth are designed to fit together, right? So this buccal cusp probably will not last very long, right? So when teeth are misaligned, actually causes trauma to the periodontal tissue, to the bone tissue, and to the teeth themselves. So let's focus on not letting our patient's condition escalate to the very top red part in this chart here, in this graph. So focusing on occlusal and oral health, because we're not healthy without healthy occlusion. So when we're talking to our patients and when we're looking at their conditions, many times you'll see an indicator of poor hygiene. And sometimes it's just the fact that our patients may have been just too lazy when they woke up in the morning or too tired to brush and floss their teeth before they came to the dental practice. But there also may be a reason why, other than that, that they have poor oral hygiene. Perhaps it's difficult to keep their teeth clean. Perhaps their teeth have shifted. Perhaps they have lost the retainers. The dog ate the retainers, and now there's ortho relapse. So these conditions that we see that we want to help avoid getting to that very top of this graph here, because if these conditions are left untreated, it can lead to serious, painful, and very expensive consequences for our patients. And I find as healthcare professionals, really, it is our responsibility and our obligation to help avoid these consequences for our patients. Malocclusion being a progressive disease. And what does that mean? It means that it will not stop if it is untreated. It will continue to worsen over time. And many of our patients feel that their teeth have always been like this. So it's up to us to actually educate them as to the disease state that they are in and let them know that this condition will continue to grow worse over time. It will lead to physical issues. It will lead to tooth breakdown. It will lead to tooth loss. It will lead to gum disease. So gum disease as a result of occlusal disease. Okay, so these are just little tips and cues that we need to keep in mind when having these conversations with our patients. It might just very well lead to functional issues, right? Difficulty eating, difficulty speaking, jaw problems, right? If you feel any popping in your patient's jaw or they have any tenderness, ask yourselves, what else could this mean? Could this be a condition due to excessive wear? Perhaps they don't have the proper form and function in their bite, and asking ourselves why. And taking a look here when your teeth are actually not meeting in the proper vertical forces, the wear that is happening, the abfraction lesions that are actually starting to take place, and sharing with our patients that these are symptoms of this occlusal disease. Improper effects, improper forces. Okay, this picture here came from a patient asking me, can you show me some evidence of how this is a progressive disease? Like, what will happen if I do nothing, was their question. So just did a little search online, and this is what we came up with. So this is what can happen if you do nothing, right? So it's educating to the evidence here. So we know what not healthy is. And we know what happens, and that malocclusion is a progressive disease, and it will most certainly get worse over time if left untreated and lead to consequences, costly consequences, or painful consequences for our patients. But it's also important that we know what healthy looks like so we can educate them to that as well. And it also then falls into our standard of care and excellence in our dental practices to talk about what is healthy. This here from the from the World Dental Federation, just a snip of what their definition of oral health is. So the definition of oral health: the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions, is a fundamental component to one's quality of life. So as a dental professional, this is a big part of why I can have this conversation and what leads me to have this conversation with our patients, right? This is a profound responsibility for us as dental professionals to guide our patients and to guide our why we're having this conversation with our patients about their occlusal health and clear aligner therapy. So our standard of healthy occlusion, right? So if we set a standard in our dental practices of what healthy looks like, we can then better educate our patients to this standard. So we're looking at proper arch form and proper arch width. So we're looking at a nice U-shaped wide arch. We're looking at the proper buccolingual inclination. We want our teeth to be upright in the proper vertical position, not tilted in towards the tongue and not tilted out towards the cheek, but upright and protected, right? We want the proper overbite. We want the proper overjet. We want our teeth to be canine guided and protected. Yeah, we have little points on our canines for a reason, right? When we move left and right, we want the canines to guide, right? And we want posterior intercuspation without interferences, right? We want all those peaks and valleys, right, in our molars to meet together in a protected, healthy bite. We want that lid to fit on that jar so that it functions properly. This should be the standard of healthy occlusion in our practice for our patients that we can educate them to. So what does healthy occlusion look like, really? So we saw the other diagram where it was meeting on that buccal cusp. Here, we actually have evidence and visuals of what the proper vertical support looks like, what the proper function looks like when our teeth fit together. So our bite is designed to fit together to support the healthy function of each tooth. The forces should come straight down, vertical, right through the long axis of the tooth. Again, our peaks and our valleys are meeting together, just as our teeth are designed to do. When we don't have the proper function, that's when we start seeing destruction. We start seeing excessive wear. We start seeing gingival clefting. We start seeing recession. We start seeing bone loss. That pounds of pressure, right? The forces in our bite, when not protected, become destructive. That's what we're referring to when we say that malocclusion is a progressive disease. So how do we assess healthy occlusion? Our little tips, our tricks, our tools, right? There are ways to analyze this in the dental chair. Articulating paper, the beautiful full arch articulating paper, is one of my favorite ways to have the patient just bite down, tap, 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 side by side, right? And you can look and you can show your patients with a mirror all the forces and how their bite is distributed. And if it's equal and simultaneous, that they're biting down and the forces are distributed equally, right? The digital scanner, if your scanner has a heat map, this is also another great educational tool. And then one of my favorites, it's like a digital articulating paper. It's like articulating paper on steroids when your patients can actually bite down and it digitally shows all the forces and whether you have that equal distribution in the anterior and the posterior when your patients are biting down, or if they don't have all the contact on one side. It's a great visual to educate your patients to. You're educating them to their condition. But still, I'll say that old school, just turn around and in the drawer in your operatory, you can pull out a piece of that full arch articulating paper. It is it's a great tool for our patients. So who would benefit from treatment? Right? We see all these patients in our practice every day. We learned in the very beginning that 75% of the patients that walk through our door present with some form of malocclusion. Most dental professionals that I have this conversation with say, San, what do you mean 75%? It's like 100% of patients that walk through my door present with some form of malocclusion. So I threw together a little acronym for you: SMILE, S-M-I-L-E. And when we ask our patients to smile, It actually, a smile speaks 1,000 words, really. It's a great indicator for us. But a good place to begin, right? If you are a hygienist, if you're a doctor, if you're seeing 8 patients a day, if you are working a 4-day work week, 75% of your patients, or 7 out of 10 of your patients in 1 week, that's 24 patients in 1 week that will present, according to the statistic, with some form of malocclusion. That is a wonderful opportunity to begin educating our patients too. This number here is a great goal for us to set for ourselves. And yes, it all starts with education. It all starts with looking at what healthy is. It all starts with the assessment of what is not healthy, right? If we see abnormal wear, if we see breakdown, recession, abfractions, all of that. So statistically, 24 patients can benefit at least by you having a conversation or starting a conversation with them. We know not all 24 are going to start treatment right away, but at least you've planted the seed, right? And this is, again, our professional responsibility to share a therapeutic approach to a condition that we see in our patients' mouths. So if we take that number and we do 75% of these patients, it's 96 patients a month. That's huge in our practice. And it is a great mindset to think of and to work towards, to think that we can have this many conversations in a month. And who knows how many patients actually then will get started, and they will be on their road to the best occlusal health they can have and under your care. So how will you know, right, which patients will benefit? If it's 100% of your patients, if it's 75% of your patients, these patients here that are showing up, it's your 7 a.m. patient, it's your 10 a.m. patient, it's your before lunch patient, it's your after lunch patient, right? That is having a hard time keeping their teeth cleaned and thinks, oh, it's National Hygiene Month. That means that my hygienist wants to take care of what I wasn't able to take care of myself. But there are this here, the lower anterior crowding, this is so minor right now. But what we now know, that malocclusion is a progressive disease, that this condition will continue to get worse. Right now, it's very minimal, but we want to stop it right here. This is where the conversations need to start, actually. So you have the bite right here, this omega shape. This lid on the maxillary arch does not fit on the jar that is the mandibular arch, right? These teeth are not fitting together in a healthy, protected bite. Many of these patients might be very comfortable. Many of these patients might be very happy. It is our responsibility to share with them that their condition is a progressive condition, and this is something that we call occlusal disease. They have occlusal trauma, or they have a traumatic bite. And how do we move forward with recognizing and having these conversations? So if we put the SMILE acronym to use here, and we look at what the SMILE actually means, so we are looking at S for slipping or shifting of contact. We're looking at M for malpositioned teeth, teeth that are not in a healthy protected bite. We're looking at incisal wear. L for lingual inclination, teeth that are tilted in towards the tongue. And we're looking at enamel breakdown, perhaps where there might be some abfractions that are starting in our patients' mouths and the enamel is breaking down and wearing away. So if we go to our S and we ask our patients to smile. When they sit down in the chair, patients come to our practice in a lot of different moods, right? Some are really happy to be there. Some are really not happy to be there. And I find that when you ask someone to smile, it just kind of breaks down that wall. And it really makes us and gives us that connection with our patients. We talk about comprehensive dentistry and being in relationship dentistry, right? So it's caring for that person. It's not just looking at their teeth, it's actually caring for that person within that teeth and also the health that they present with. So if you ask your patient to smile, I love to compliment them. Oh, you have a smile that just lights the room. Thank you for making my day, right? And it's going to change their whole disposition. But take a look at what's in the smile, right? Take a look at the occlusal health that you see here. Take a look at the conditions that you see. This patient may not see this. I mean, they're not normally in a retracted smile when they are smiling. So they may very well not know that they've had patchwork dentistry here, right? So what do we notice inside of our patient's smile? Is it healthy or is it not? If you take a look, this patient probably does not know that they have recession here unless they're sensitive, unless when you take out that Cavitron to clean their teeth, they're actually going through the jumping out of your seat and clinging onto the ceiling in your operatory. So this would be occlusal trauma, right? This is not healthy. We're looking at teeth are here that are lingually inclined. We're looking at anterior crowding, right? This patient has excessive incisal wear. This patient does not have healthy occlusion. This patient here, this is just a train wreck. This is a crash. This is a collision happening. This is a traumatic bite all around. It's a cross bite here in the anterior. It is just improper buccal lingual inclination. These teeth are just in such traumatic occlusion. They are colliding every time they bite down. They are not sliding in that proper envelope of function the way our teeth are meant and designed to when we have a healthy, protected bite. And then E for enamel breakdown. There is so much enamel breakdown here. There is so many abfractions going on in this patient's mouth. And in addition to which, we're looking at the pocketing here, the gingival pocketing. You have gum tissue here that is very, very, very angry, not happy at all. We have recession. We have some clefting happening up on the upper left, and then the lower right here, we have pocketing as well. So this patient's not healthy. We're their hygienist. If we're looking at gum disease, right, we're talking to our patients about gum disease. If we see periodontal disease, we're talking to our patients about periodontal disease. Let's talk to our patients about occlusal disease and fold that into the treatment planning process. Let's talk about what is ideal. It's important that we know what is ideal, to set our standards for our patients, to bring them and guide them towards the best oral health they can have. It's National Hygiene Month. We want to actually just be their superheroes this month, right? So what is ideal? Ideal for our patients of what we're looking for is healthy, right? We're looking for our patients to have a stable bite, a stable protected bite. We want our patients to have function, proper function. This many times ends up being a conversation of patients feeling that they're too old to move forward with anything, but they're never too old to focus on their oral health. We want our patients to have proper form and function so that as we all are aging, we can chew properly, we can eat properly. If we're chewing properly and eating properly, we can absorb the nutrients in our food, which also goes throughout our whole system and keeps us healthy. We want our patients to be comfortable, right? Some patients will come to you, they will be hand raisers. They're coming to your office for a straight smile. They just always wanted their teeth straightened, and that's going to be someone that's aesthetically driven. But the bottom line is, if we're caring for our patients and bringing them to the best oral health we can, if we're making sure that their bite is stable and protected, if they have the proper form and function, and if ideally they're comfortable, they're going to have an aesthetic result that they didn't even know they needed. And it's profound the impact that this has on our patient's sense of confidence and well-being. We talk about the definition of oral health. It is amazing, just the transformation that our patients go through. They're feeling better, and then ideally they are somehow looking better. So let's talk a little bit about some fun stuff here. And where does crowding come from? Crowding comes from a lot of different places, and three in particular: arch width, arch form, and buccolingual inclination. But we could have trauma, we could have ortho relapse, we could have patients that are mouth breathing, we could have patients that have some type of parafunctions. Perhaps they were sucking their thumb as a young person. Perhaps they have some, airway issues, narrow arches, and they might just have poor dental care because they're not able to take care of their teeth the way they should because their teeth are not in the right position. So let's talk a little bit about arch form. Crowding comes from improper arch form, right? As one of the topics here. So what ideally we're looking for is that nice U-shaped arch, that nice Roman arch. We're not looking at a V-shaped arch. We're going to X through that. That is not the proper arch form. A square arch is not a proper arch form, and the omega is not proper arch form. Ideally, what we're looking for in our patients is, again, that beautiful U-shaped arch. Think of these other shapes here, as I mentioned a little bit earlier, is the lid, the maxillary arch being the lid, and the mandibular being the jar. And if that lid is not able to fit on that jar, right, the jar doesn't function well. If you have salad dressing or something in there that you're looking to shake up, it's going to spill out. It's going to leak out. It doesn't have the proper function. And I love using these analogies actually with my patients just to give them a visual of what is actually happening here to help educate them on moving forward to having clear aligner therapy, again, to bring them that beautiful U-shaped arch, which is ideal so that their teeth fit together in the proper healthy occlusion. Let's look a little bit at arch width here. So crowding also comes from improper arch width. We're looking ideally at a minimum of 36 millimeters measured at the first molars, the mesial to the first molar, actually right down at the gum line is where we're measuring to get that arch width, the ideal arch width. And if they have anything less than 36 millimeters, right, there's an arch width concern. And chances are that lid, again, is not fitting on the jar. They don't have proper form and function here. The little patient over here at the very end with 25 millimeters of arch width, their tongue doesn't even have a healthy place to live, right? So our tongue is supposed to be high, and in the palate, this is a very high vaulted arch here, and their tongue more than likely is sitting uncomfortably in the back of their throat, which causes little interference when it comes to healthy breathing. So, and then very important that we look at the buccolingual inclination. And this many times is an oversight. We don't realize that our teeth should be upright in the proper vertical inclination, right? Not tilted in towards the tongue. And a good indicator here is if you take a look at this patient's tongue and you see little scallops along the side, that's not a pretty look, right? Teeth should be upright and protected, lid on jar, functioning together in unison. So the diagram over here on the left, when we look at the buccal cusp, and we saw again earlier that diagram where the opposing arch was coming down on that buccal cusp, you can imagine with all those forces that buccal cusp is not going to last for long, right? And this eventually leads to tooth wear, tooth loss, right? It'll lead to mobility. It's going to lead to recession. There's going to be abfractions. So this is considered excessive inclination. And if you took, well, we probably don't have a level plane in the dental drawer, but what you can do is actually that cotton swab, right, that has the wooden stick on it. If you were to take that and just hold that over the cusp here for your patient, give them a mirror and show them the void underneath, that means, and you can share with them, that they have no contact on this cusp. All of the force and all of the load is here on that buccal cusp. Destructive forces, occlusal trauma, right? So that's what's happening here as these teeth are excessively inclined. They're being hammered on the buccal side of the tooth. So there are symptoms that we can look for as we're helping describe where crowding comes from for our patients, right? Improper arch form, improper arch width, improper buccolingual inclination. So when you all go to the doctor, for example, say you're not feeling well and you're doing perhaps a telemedicine call, or you might be at the urgent care clinic, or you might be seeing your regular doctor, and they're going to say to you, okay, what brings you in today? I'm not feeling well. They're going to ask you, what symptoms are you experiencing? And you're going to share with them, I have a sore throat, I have a headache, I'm just really tired, I'm so achy. These are all symptoms, information that they're gathering from you so that they can come up with an assessment, right? Or they can come up with a diagnosis. So some symptoms that we're looking for to assess that our patients have occlusal disease, that they have malocclusion, right, are improper tooth alignment. So as you're doing your hygiene assessment, as you're doing your hygiene exam, make notations of the symptoms that you see that could be actually contributing to the conditions in their mouth. So improper tooth alignment would be a symptom of malocclusion, of occlusal disease. Changes in the facial appearance. Notice in your patients, sometimes the symmetry is a little bit off. Sometimes one eye might be a little bit lower than the other. Sometimes a smile, right, might just have that little crooked, and take a look straight on. When you're asking that patient to smile for you when they come in the room, notice the symmetry in their face as well. And if you see any changes in their facial appearance, or if it's the first time that you're meeting the patient and you notice that there's a symmetry that's off, make a notation of it, because that is going to give you that why and that light bulb to look a little bit deeper as what else could this mean. If you see that your patients are biting their cheek or biting their tongue, why? What interferences are there that is having them bite their cheek and bite their tongue, right? If you see any effractions, if you see any chipping of teeth, if you see any gums that are receding, right? These are, I would say, that the top three, right? That are symptoms that you're going to see of malocclusion. You might hear some speech changes in your patients, and you might notice or ask if your patients are mouth breathers. So these are all signs and symptoms, right, to a condition that we call occlusal disease. So how can malocclusion be treated? How can occlusal disease be treated? So for us to be able to talk to our patients about treatment, we need to know some of the terms that we can use to guide our patients towards treatment. I would share with my patient that how this can be treated is to give you back a healthy protected bite, or to provide you with a healthy protected bite that will help keep your teeth lasting for as long as a lifetime. It's important that we realign your teeth, that we give your teeth back that proper form and function so that all the teeth are working in harmony and in unison. And when you bite down, the forces are equally distributed. To correct the position of your teeth. Our teeth are designed to be upright and wide and forward, right? So we want to correct the position of your teeth. And how do we do that? We have a very, very non-invasive, very conservative approach here in our dental practice, and we refer to this as clear aligner therapy. With clear aligner therapy, that's our therapeutic approach to provide you with a healthy protected bite, or to realign your teeth, or to correct the position of your teeth. So these are all terms that have been very successfully used when treating and guiding our patients towards clear aligner therapy. The earlier on, so the pictures that we showed earlier, that patient that had very, very minimal lower anterior crowding, right? If we catch this then, because we know this is a progressive disease, it'll help decrease the length of treatment, and it will help decrease the severity of their treatment. So let's catch it while it's early. Let's guide our patients, right, to this path to the best oral health they can have. So getting started. How to offer a solution to our patients. Educating our patients on the long-term benefits of having their teeth in a healthy protected bite starts with digital tools, starts with analog tools. It starts with a conversation. It starts again with asking our patients to smile. And what do we see within that smile, right? Their smile is, again, one that lights the room. But it's the condition that we see within that smile that concerns us, the disease condition that we see. So correcting malocclusion can improve so much more than just a smile. This bite health evaluation form is actually one of the analog tools that I find profoundly important and very helpful in helping my patients move forward. It really is the tool that puts them right in the center of their condition. Right? So this form here goes onto a clipboard, and the patient's name is written on the top here. The date is written on the top as well. And then I will have assessed the condition that is seen, or hygienist will assess or the doctor will assess the condition that is seen. This can be used cross-functionally, in the dental practice. And the patient then has been talked to about the condition that you see in their mouth. What I'd like to do then, once the patient is upright and you're sitting kind of knee to knee and, looking at them eye to eye and guiding them through this form, say, I just want to share some information with you today and some of the concerns that I have that I've seen, and assessed during our visit today. For example, if your patient presents with crowding, I would say one of the conditions that I see is some crowding going on in your teeth. This actually concerns me. So this can lead to decay. This can lead to periodontal disease. It can lead to your teeth chipping and fracturing. I would very much like to avoid that from happening in your oral health, right? I would like to avoid this condition from happening for you. So we do have an assessment here that I'd like to go through with you. I've noticed some additional areas of concern that I would like to share with you as well. And I would focus on the teeth, right? If you see any wearing or abfractions or any clefting or any function or, malfunction or traumatic bite, check off and talk to your patients about it. The top part, the condition that I see, I actually have my patients check off the condition that I have referred to. And then let's talk about the gingival health. Let's talk about whether or not there's any bleeding. Let's talk about any gum tissue that's receding. And let's talk about inflammation. Inflammation, we know, is the root of really all diseases and problems in our bodies. If we have any type of itis anywhere in our body, if there's arthritis, it's alarming, right? If there's bursitis, it's alarming. If we have gingivitis, it's alarming. So inflammation is a really important topic in conversation. And some of the pictures that I shared with you early, where we saw that gum tissue that was just not happy gum tissue, we need to check these boxes off that pertain to the patient's condition that you see, or that are results of the condition that you see. The impact is really important. If your patients, as we know, are not healthy without occlusal health, without good occlusal health, their oral health is actually declining. And if my dental professional said that to me, it would definitely be like a call to get my attention. That would really concern me. So when you're sharing this information with your patients, make sure you share your concern for them. What concerns me in this bite health evaluation that I'm sharing with you today is that the oral health that I see is actually declining, right? Your teeth are prematurely aging. If your teeth are wearing at a rate greater than what they should be over a lifetime, the teeth are prematurely aging, because our teeth actually, in a healthy protected bite, are designed to last as long as a lifetime. So if there is excessive wear happening, our teeth are prematurely aging. So most people would feel a way about that if you tell them that they're prematurely aging. So I address these concerns, and then I share with patients, depending on the role you are in your practice. Hygienist, my assessment today, looking at these conditions here, this we would treat with clear aligner therapy. So this is considered occlusal disease, and that would be our non-invasive clinical approach here to correct the condition that you have. And I don't necessarily say refer to an orthodontist. I do say here to really recommend clear aligner therapy. Your patient will automatically see referral to an orthodontist, and they know that they don't want to go to an orthodontist, right? So without even saying it, it's implied, and they automatically then you'll have their attention for clear aligner therapy. I share my concerns, right? How important their overall health is for me and for us here in the practice, and that we would very much recommend that they move forward with clear aligner therapy to correct this condition. And then have your patient either sign or put their initials there and the date. What's really great is if you can scan this into your system at your office and then send your patient home with the actual physical copy. So this begins your education, with your patient. This is guiding them towards their best oral health, guiding them towards treating their occlusal disease. They may have a decision maker that they're working with at home. They may have a financial partner that they need to discuss this condition with. And most of our patients, from the time they're in the back in your chair to the time that they're up front at the front desk checking out, they forget a lot of the information that you've shared with them. But when you send them home with this, they're sure to remember. Another tool that I love, so that was my favorite analog tool. Another tool that I love is taking diagnostic photos. The power of proper diagnostic photos is when you actually go to submit their case, our orthos have the proper documentation that they need here, our patients in the proper position, the correct arch photos, the correct buccal photos, and the correct facial photos here. So if you're taking your patient's pictures, this is a perfect example, 3 facial photos, 3 intraoral photos. One step that I would like to guide you in is that when you're taking your patient's profile picture, when they're sitting in the chair, please ask them to actually turn, or you turn to the side so you can get their full profile. It's best not to have them just turn their neck like that, but to actually have the profile so that you can see again the symmetry and the alignment in their body. And my third favorite tool when it comes to educating our patients is actually the intraoral scan. And that full upper arch scan and that full lower arch scan, that digital impression, right? And there are ways that you can have the best results. You want to make sure that the teeth are dry. You want to make sure that there's no holes or distortions in the scan. You want to scan at least 3 to 5 millimeters of the gingival tissue. So this scan here, this is your patient's bite, right? So we used to talk about bringing our hands together and showing our patients their bite. Now this is their digital scan. So the digital scan, the photos, and the bite health evaluation are going to be your 3 best friends when it comes to educating your patients. Part of what we're educating our patients on is the inflammatory response that's happening in their body, right? It's the inflammation that we see and we know. The tartar, the plaque, the bacteria that is in our mouths is also now through the rest of our body. We know that inflammation is the root cause of so many major diseases. And most recently, learning that Alzheimer's is one of those diseases. Memory loss conditions are one of those diseases. So educating our patients on the condition that is happening in their mouths is also affecting the rest of their body. So this is our educational tool that we just showed, the photos, the digital scan, and the bite health evaluation to help guide our patients to the path, down the path of their best oral health. So it is the little things that add up. We talked in the very beginning about just the minimal lower anterior crowding and how this is considered an occlusal disease. And this is a progressive disease and will not get better. So anterior crowding of 3 millimeters or less serves as an individual host factor for bacteria. We're looking for our patients to be healthy occlusion, right? The patient has a very difficult time keeping this. This contact is very tight, right? The tartar calculus buildup on the lingual side is very hard. They don't have access to that area at home, right? So they're coming to you more. So we get to educate our patients about the inflammatory process and correcting and reducing that. It's the little things that add up. Some of the benefits of clear aligner therapy: easier hygiene appointments. We can celebrate that in National Dental Hygiene Month. Reducing plaque and inflammation. We can celebrate that all the time, 12 months out of the year. And providing a healthy, protected bite for our patients. After all, what are we here for? We're here to be the reason that somebody smiles, right? We go back to the definition of oral health, the ability to speak, smile, smell, taste, touch, chew, and convey a range of emotions, and that it is a fundamental component to one's quality of life, right? This is what we get to bring to our patients. We can do that during some of the conversations we have with our patients, to help guide them towards moving forward with clear aligner therapy. I like to use ING words with my patients. ING words are action words. It means that this condition is actively happening. So for example, when you're using the bite health evaluation, or you're sharing the digital scan, or you're showing the patients their photographs. So at the end of their appointment, if your patient is sitting up and they're upright and you're knee to knee and guiding them through this process and educating them to the conditions that are happening in their mouths, when you share with your patients, Courtney, I'm concerned about the overlapping and crowding of your teeth. Courtney, if this condition is left untreated, it can lead to problems chewing and speaking. It can lead to your teeth chipping and cracking, right? Courtney, at this time, I highly recommend having an orthodontic assessment. Let's have accurate records taken, and let's work up a plan to resolve this condition. Courtney, does that work for you? Using our patient's name, using words that are actively happening, using our ING words. Janelle had a condition where she had an open bite and spacing, went through the bite health evaluation form, went through the photos with her, and had a digital scan. And I'm able to say, Janelle, I'd just like to share a little bit of, what I've observed today during your appointment. And Janelle, what concerns me is that your upper and lower teeth are not meeting properly, right? If this condition is left untreated, Janelle, it can lead to serious problems, chewing, it can lead to some jaw problems here, and it can lead to difficulty, maybe some speaking problems. So Janelle, at this time, I highly recommend having an orthodontic assessment. Let's have some accurate records taken, right? Let's have the doctor come and work up a plan to resolve this situation for you. Janelle, does that work for you? Right? Dave, having this conversation with Dave. Dave was a pre-restorative case, very deep bite, very narrow arches, right? So Dave, there are lots of concerns for Dave in having this conversation. Using the ING words, these things were very, very actively happening. So you can very comfortably say, Dave, I'm concerned that your upper teeth are closing down too far over your lower teeth, right? And that your upper and lower jaws are very, very narrow. Dave, if this condition is left untreated, this condition can lead to jaw problems. It can lead to difficulty chewing. It can lead to speech problems, as well as trouble breathing, Dave. So at this time, with the scan that we have and the photos that we have, and having gone through the bite health evaluation, these are good, accurate records, Dave. Let's have the doctor come in and work up a treatment plan for you to resolve this situation. Does that work for you? And the conversation, that guiding and using the ING words, that this is actively happening for your patients, really gives them the ownership of their oral health care. You're putting them right in the center of the concern. Our patients have excuses, though. We're not here, sprinkling pixie dust and saying that this is all going to magically happen. But this is the path, right? It's understanding what malocclusion is. It's understanding that malocclusion is a progressive disease. It's understanding that malocclusion is a disease classification, right? It's understanding what happens as a result of a traumatic bite or occlusal trauma. It's understanding how to have these conversations with our patients based on, now we know what is healthy, right? So, and then with this information that we're sharing, it helps us help our patients overcome their objections. So some objections are, why haven't we talked about this before? I always share with my patients, I understand your concern. Other patients have felt the same way. But one of the reasons why we haven't talked about this before is what we now know is we better understand the relationship of occlusion in our patients' mouths. And we now know that we see effects from a traumatic bite in our patients' mouths. So we follow the science, and we'd like to advance our protocols here in our practice to bring you the best in class oral health care. So that is one way of letting your patients know, but start with their name, let them know that you understand how they feel, let them know that other patients have had this same question. I don't think that my insurance will cover this. And I would say to my patients is, if you are one of the lucky few that actually has adult orthodontic benefits, I will work to maximize your dental insurance to see to it that we can get as much of your adult benefit to cover the expense here. After that, if you do not have dental insurance, don't worry. All right, we can work out either way an affordable, healthy option, financial option for you right here in our practice. Right? I'm sure it's too expensive. Other patients have shared the same concern. I understand your concern. I will share with you that we will do our best here. We work with several, third-party financing companies, and we will do our best to come up with healthy financial solutions for you. You moving forward with this treatment is so important to us that we're going to do everything in our power to make sure that this works for you in a healthy budget. Right? I think I'm a bit too old for this. You heard me mention earlier when patients have this objection, and our comment back to them is, you're never too old to be healthy, right? We want to ensure your health. We want to ensure your function. We want to ensure your comfort. We want to ensure that you keep your teeth for as long as a lifetime and that they are in proper form and function. You are never too old for a healthy bite. I really don't want braces. I understand. Most adults don't want braces, but I'm here to share with you that here in our practice, how we provide the healthy protected bite is through clear aligner therapy. You don't have to worry about wires and brackets. What you will see is barely visible. So that is a good way to help our patients overcome some objections. You've gone through the process with them on how to have the mindset of what is healthy. Again, not everyone is going to move forward with treatment right away. Some take time. I do like to document the conversations that I have with my patients. I do like to document the symptoms that we talked about earlier. We are on a journey with our patients, right? We are guiding them on their path to health, to their best oral health, their oral systemic health. So our chairside guidance to you, this knowledge, information to help you better educate your patients, right, is designed to help you facilitate an occlusal health assessment. During that assessment, you're able to now identify risk factors that can affect stability. If you see that your patients have a traumatic bite or they have occlusal trauma, and we know now that with those improper forces, that eventually there is going to be mobility. We saw that in the bite effects visual effect earlier. There's going to be mobility. That is going to directly affect the stability of their teeth. There's going to be further breakdown from there. We're able now to assess whether or not there's clefting, whether there's recession, whether there are abfractions going on. Those abfractions, those class 5s aren't going to last very long in our patients' mouths if their bite is not stable. Periodontal health at risk due to occlusal trauma, an improper arch form, an improper function, right? We learned earlier about the proper arch form, proper arch width, and our teeth being upwardly inclined, the proper vertical inclination. If we see anything other than that, there is a risk factor. So with this information today, it gives you something additional to talk to your patients about as a dental professional, as their hygienist, as their doctor, that these are conditions that you're assessing, and the condition and the solution that you're coming up with would be best dealt with clear aligner therapy. So during presentations, I always find it impactful to make a commitment to growth, right? So through the knowledge and information that we shared today in the presentation, how does this help expand your professional self? How does this benefit your patients? And how does it benefit your practice? And what role can you play in all of that? I like to measure growth always in our practice, and when coaching other practices, we talk about measuring growth. any time that that Bite Health evaluation sheet is used or there's been a conversation about occlusal health or occlusal disease, we actually would track that code and use the unspecified ortho by report code, the D8999, and then do like a 0.5 for an in-house code assessment. But your patients going home with that sheet, and then also on their either emailed receipt, or if you're giving them a paper receipt, some patients still want a paper receipt, but it'll show up on the receipt, the D8999. You'll have down Bite Health evaluation, and then perhaps any follow-up notes that you have for your patient, right? Discussed moving forward with clear aligner therapy due to occlusal trauma. So with all that being said, thank you for taking time today out of your day, again, to kick off National Dental Hygiene Month. This presentation does offer you one continuing education credit. And if you would like to scan your QR code, I will hold this sheet up for you here for a little while and make sure that you are able to answer all those questions in a timely fashion. I want to thank you all for joining the presentation today. And I'll let you take the last few minutes here to get your CE, and you will receive that, your continuing education attendance in the email that you registered with. So thank you again on behalf of Candid Pro for taking time out of your day. I'll just keep that up for you for, again, a few more minutes, and make sure you all have time to scan, get your phones out, move the lunch to the side. So it looks like everyone has had the opportunity to scan the QR code to get your one continuing education. Thank you all very, very much. Wishing you a great rest of week and a great National Dental Hygiene Month. Thank you so much.